Hello everyone, my name is Signe Fremel and I am presenting with Patschke. This is our overview of our research on the effectiveness of digital health tools for middle-aged and older adults in the United States with type 2 diabetes. First, let's review the term digital health tools. We can refer to this term as an umbrella term that includes mHealth, eHealth, telehealth, telemedicine, wearable devices like watches, personal health devices, health information technology, and electronic health records. I listed a few examples on the right side of the slide, but digital health tools have revolutionized healthcare through the use of computing platforms, connectivity, and automated sensors, and this can support and provide patient-generated data and concerns that can help inform clinical decisions and enable a more personalized, holistic, and patient-centered approach to care and management of chronic diseases like type 2 diabetes. Now let's discuss the significance of digital health tools for type 2 diabetes disease management. The use of digital tools for type 2 diabetes self-management was first looked at in the 1980s and 90s when at-home self-monitoring blood glucose devices first came to the market. Throughout the early 2000s and until 2015, there's been a lot of exploration with the capabilities of digital health tools. This is also when the terms mHealth and eHealth were first used. Self-monitoring blood glucose at this time became the standard of care, and then we saw the innovation of real-time continuous blood glucose devices with Bluetooth capabilities, and that enabled type 2 diabetes disease management at the fingertips of the user. Looking at today, there has been an increased interest in how these tools can be used to produce positive behavioral outcomes through automated and real-time feedback that directly connects patients with evidence-based healthcare advice. As you can see, since 2019, I highlighted there's been a lot of innovation in this area because telemedicine and telehealth became the norm at that time. And there's an intended purpose of digital health tools, but it's all work in progress. In this literature review, the databases PubMed, Signe, and Epicos Host were searched. We searched for middle-aged and older adults living in the United States with self-reported or diagnosed type 2 diabetes. Interventions that used mHealth, eHealth, telemedicine, telehealth with nutrition-related components for self-management were selected, and our primary outcomes of interest were clinical outcomes that include HbA1c and quality of life, behavioral outcomes related to self-management of disease, such as diabetes distress and self-care activities, and 11 studies were selected for this review.
Since many mHealth approaches are multifaceted and examine many different criteria, the results of this review are broken up into two categories, clinical and behavioral. For clinical outcomes, we focused on HbA1c, as it is one of the best markers for indirectly monitoring blood glucose levels in patients with diabetes. Listed here are the results of 6 of our 11 studies that showed significant improvement in HbA1c compared to control groups. Of those 6, 2 demonstrated a sustained reduction at follow-up assessments performed after the intervention had ended. As you can see, there were a variety of different approaches used, including video conferences, mobile apps, telephone-based counseling, and combinations of other approaches. For behavioral outcomes, several different criteria were used by studies to demonstrate positive behavioral change, including those listed below. 7 out of the 11 studies in this review found significant improvements in these behavioral outcomes compared to the control groups. The results from this review support the hypothesis that mHealth solutions can benefit both HbA1c levels and key behavioral outcomes related to diabetes management. mHealth solutions are becoming more prevalent and have already benefited thousands of individuals. Advances are being implemented to make mHealth more effective and accessible for all. These advances include peer coaching models and the use of culturally tailored interventions. User-friendly interfaces are becoming more common, which allows even those who are unfamiliar with the technology to easily access tools and resources needed to better manage diabetes symptoms. However, it is important to note that while the current results are promising, there was much variability in the methods and approaches. And due to the lack of consistency in methodology, more research is needed to determine the effectiveness of specific mHealth solutions.